These are the real stories of the ER that doctors never talk about.
We pissed blue, Doc. What's wrong with us?
How many more?
10.
10?
This is now approaching what we call a mass casualty situation.
Now, we're not quite certain exactly what's going on inside the hospital.
We do have the medication to treat it, but it could potentially be lethal to you and your baby.
No, I can't lose the baby.
It's an impossible choice.
Not only does she seem really nervous, but she's really pushing, like, can we transfer her?
We are leaving right now. Right now!
Pick up for Vlad and Natasha.
Take us to the airport.
These are the untold stories of the ER. Dr. Travis Jasper splits his time between ER medicine and coaching his nephew's 8th grade basketball team.
Yo, Coach, how'd we do last night?
We won by 5. We're going to the cities.
How'd we beat Lancaster's all-city backcourt?
You know, I'm glad you asked. See, it's all about the weak side. All game, they forced us left, so my nephew Kendall, he took it. But then, last play of the game, we go right.
Doctors, you're gonna want to hear this.
And then I hear the EMS radio. And we hear the EMS radio, and one of the nurses takes the report, and they're telling us that we're receiving a patient from the airport.
The male passenger on an international flight, mid-30s, found unresponsive after the plane landed. Vitals are good, but he is sweating profusely. No medical history. The ETA 5 minutes.
Game on. And one of the other things we hear is, you know, we're gonna need some help on the gurney because apparently he's really large. So, you know, you don't have a lot of time to really prep, but that's part of what gets the adrenaline going. I mean, this guy was really huge, just pouring with sweat. And his wife or girlfriend was in a panic and yelling at someone on the phone.
Kurva, vilket problem?
Hello? Can you hear me?
Hello.
I'm Dr. Jasper. What's your name?
Vlad, his name is Vlad.
We're gonna take care of you.
Yuri, there's them. This big baby, this stupid man-child. He won't wake up.
Wait a minute, team. Hold on. Stilts, grab some guys and come give us a hand in here. Miss, can you just stand over here, please?
Okay, but doctor, you must take very good care of Vlad. And fast. We have a connecting flight to catch.
What's your name?
Natasha.
Well, Natasha, I'm not sure he's gonna be able to fly anytime soon. I need to examine him and find out what's wrong first.
Okay, people, on my count. 1, 2, 3.
One more time. Let's mean it this time. 1, 2, 3. All right, let's get going in here.
Vlad, let's go. We have a connecting flight to catch. Vlad, let's move it.
I was like, what? Hadn't she heard me? This guy's not going anywhere. He's unconscious.
Move it, Vlad, come on.
Los Angeles-based Dr. Bob Slay loves to teach.
Hello, my medical munions.
And his unique style keeps young residents on their toes.
Today we're going to have a little lesson in observation. This is a urine sample that I brought here because I'm going to give you a little lesson in observation. Observation is the key to diagnosis in medicine, as many of you already know. So what we're going to do with this urine sample is we're going to learn as much as we can observing it. And what we're going to do first is we're going to treat it like a fine wine. First thing we're going to do is we're going to look at it and see how clear it is and see the color. Now the color here is yellow. If it were really dark yellow, it might mean the patient's dehydrated. If it were brownish, it might mean the patient had liver disease. It appears to be clear. If it were cloudy, it could be infection or something like protein in it. We're going to smell it. You all know what your asparagus smells like when you eat it in your urine. That's one smell, but there also smells like ketones that would indicate diabetes or a sweet smell. Finally, we're going to, as they did in ancient times, taste the urine. Just a little taste. Put my finger in here, and then put them out. Not too bad. You know, in the ER, I pulled my share of practical jokes on people and on the staff, but in the ER, you've really got to learn to be observant. Observation is the key to diagnosis. And so we really have to teach these kids to be observant. That's really important. Now, I'd like each one of you to try it. Sherry, why don't we start with you? I want you to observe this urine. I want you to make all the observations I did. Go ahead. Take a look at it. Tell me about it.
It looks like pretty yellow. You want me to...
Yeah, smell it, absolutely, please. Tell me what you smell.
It smells really sweet.
Okay, now we're gonna taste it. Go ahead, it's perfectly fine. It's part of observation, taste it. Good job, what's that like?
All right.
Remember we were talking about observation. If you notice, when I tasted it, I put my index finger in here like this, and then I tasted my middle finger. But don't worry, it's my urine. Come to think of it, it looks a little bit cloudy. I think I'll run it through again. A little aftertaste. Don't freak out, people. Remember, we talked about observation.
Here's something that needs careful observation.
What the heck is that? I was told that there were 3 or 4 fraternity boys from the local university who had with them 2 of their fraternity brothers who had a chief complaint of blue urine, and they were feeling dizzy, lightheaded, and panicky. Hi, guys. Dr. Slay, hi. So what's going on?
When we woke up this morning, we pissed blue, Doc. What's wrong with us?
Listen, come with me, you guys. Come on, let's go around here.
Hey, Doc, where's the men's room?
Right there to your right.
What's going on?
Wow. Wow, your heart's really racing.
I know, and I feel like I'm getting worse. Do you feel really lightheaded? Like...
Short of breath?
Yeah.
You're really short of breath. Lie
Many
down.
medications and medical conditions can cause blue urine, but none are life-threatening. For Dr. Slay, the shortness of breath and racing heart rates of his patients are far more serious signs of trouble.
We put them in bed, and as we were hooking them up to IVs, getting vital signs and so forth, they continued to answer yes to every single question I asked and review of systems. Feeling tingly in your hands and feet?
Yeah.
You feeling hot?
Yeah.
How about chills?
Yeah.
The fraternity brothers seem to be getting worse instead of better.
P blue. High P blue. P blue. Come blue.
I don't like the looks of that.
When Dr. Eric Snyder spots a pregnant woman in the ER, he's immediately concerned.
This was somewhat unusual. We don't see typical term pregnancies in the emergency department except under duress. The nurse brings back a young woman who's clearly pregnant, which is unusual because typically pregnant women, after about 24 weeks of gestation, will go upstairs to labor and delivery because most of the problems they have can be managed by the obstetrician or the obstetrical nurses.
Hi, I'm Dr. Snyder. Pleased to meet you.
I'm Susan.
Hey, I'm Walter, Susan's husband. Pleased to meet you.
Are you having contractions?
No contractions. Just my whole body hurts.
And a pregnant woman, again, the first thing that I think of is she's gonna deliver. We typically don't want patients delivering before 36 to 38 weeks so that the baby's lungs can mature.
How far along are you?
28 weeks.
And is this your first?
The longer the baby remains in utero, the better it is for the child.
My legs are cramping. My belly's cramping. I don't know what's happening.
And when did these symptoms first occur?
About an hour ago at my baby shower.
BP's 140/90, heart rate's 90.
Now, with those set of vital signs, you start to think of preeclampsia, which is typically defined by elevated blood pressure, your kidneys don't work as well, so you get swollen, and then what happens if you don't treat it aggressively, they can go into eclampsia, and then they start to have seizures.
The only cure for preeclampsia is delivery, but since the infant is dangerously premature, Dr. Snyder must confirm that a diagnosis of preeclampsia is correct.
Have you had any problems with high blood pressure before?
No, never.
Are you taking any medications?
Just vitamins.
And is there anyone in your family that has had any perinatal complications?
No, never. Am I gonna be okay? Is my baby gonna be okay?
Your blood pressure's just a little high. We're going to monitor you and your baby and see if we can't get some answers. Jody, start an IV. We're gonna get that blood pressure down.
And so as soon as we got the baby on a monitor, I could see the baby wasn't responding well to this. And so the baby had what's called decelerations. And the heart rate, you know, typically you want it above 150.
140.
And it was dropping to about 140, 120. I'm very concerned.
I can't, my head is throbbing.
We had several other ER patients hearing and seeing what was going on with the blue urine, decided they would now leave, not wanting to get sick.
Dr. Jasper is treating an unconscious patient with an undiagnosed ailment and a very erratic traveling companion.
Floyd, stop lazing around. We have a flight to catch. We have to go.
His oxygen saturation was good. So at this point, I'm wondering, is there something going on maybe in his brain? Could this be something like a stroke? Ma'am, blood isn't going anywhere. You need to go with Lana here and fill out his paperwork.
In a minute. I have to make a phone call.
So she runs off again, and we get some IV fluids in our patient, and he slowly starts to come around. Sir, Vlad, hello. Can you hear me? Where'd you come from today? Where'd you travel from? You know, I'd have one moment where it goes, and then I have 1 minute, and I said, do you have any other medical problems?
No, I don't.
And every few seconds, he would make some sense, and he would go right back out. That's what was really weird about it. So at this point, and I'm thinking if it's a stroke, he shouldn't go in and out. And I'm doing an exam because I want to make sure his lungs are clear, his heart sounds regular. I'm feeling to see if he has tenderness in his legs, if they're swelling, something to give me a hint. Lord, I'm gonna squeeze your legs down here. Let me know if there's any tenderness, okay? And I'm thinking maybe he's diabetic. And, you know, we go back and we review with EMS. Well, did you get a blood sugar? They're like, yes, his blood sugar was normal. So that kind of threw off the idea of diabetes. Let's get an EKG. So we're grabbing our EKG, and I get a chance to look at that, and his EKG looks normal. So I'm really sort of scratching my head at this point. I'm thinking, it doesn't really fit for a stroke. His vital signs are great, and usually in a patient that looks this bad, their vitals are gonna look equally bad. So I'm going, if it's not that, what is it? Let's go ahead with blood work. I need a cardiac panel, BNP, D-dimer, UA, UDS, and we'll get a chest X-ray.
Wszystko je dobre. I know what it is. I figured it out. He can go now.
You know, it was confusing. And this Natasha, she was getting stranger and stranger.
I figured it out. He ate my sleeping pills. He thought they were candies. By mistake. He does that. I decided to take him to see my doctor in New Jersey.
New Jersey? What are you talking about? Because during this time, not only does she seem really nervous and scared, but she's really pushing, like, can they leave? And she figure out how to get him to, you know, his hospital at home. Blood. Did you take her sleeping pills by mistake?
No,
Blood. Where are your sleeping pills?
They are all gone. He had them all. But like I said, I have made a decision for Vlad, and I think it's best if he see my doctor, who know him best.
I don't think we're quite there yet. I still need to get blood work. We need to get some x-rays. We have to finish his workup.
No.
None of what she was saying made any sense. But when I threw out the idea of an x-ray, she got even more panicky.
No X-ray.
What do you mean?
We are trying to have children. Nothing will come between me and my children. Nothing. No, we try to have baby. No.
Calm down.
No.
Calm down. An
No.
X-ray will not damage his ability to have children.
No, no. We are leaving right now. Right now.
Hold on a minute. Nobody's going anywhere.
Yes, come on, Flint. Let's go. Move.
No,
Pick up for Vlad and Natasha.
Ah, yes. We are ready. Take us to the airport. Pomoż mnie. Come on.
Then things really got crazy.
Yes. Come on, Vlad. Vlad.
What was she thinking? She wants to take him to the airport in a limo?
Dr. Slay is trying to figure out why a group of fraternity brothers have rapid heart rates and blue pee.
Let me guess, you're from the fraternity.
Doc, all of us we pee blue.
Sherry, we're gonna need 3 more beds.
Yeah, right away.
So now they're put in other gurneys too, and lo and behold, they're developing the same type of symptoms. So now we have 5 of these fraternity brothers who have blue urine and feel like they are losing a grip on life. At this point, I was getting somewhat concerned. We had sent off blood work on the initial fraternity brothers. We had checked their urine. We had checked them for a disease called methemoglobinemia, which can cause blue discoloration in people from various kinds of chemical agents. That turned up negative. You ever seen anything like this before?
Doc, I can't breathe. Me too, Doc. I can't, my head is throbbing.
All right, listen, guys. Try to relax, try to calm down. We're gonna take good care of you. We're gonna figure all this out, okay? Try to calm down. Take some deep breaths.
We've got 2 more frat boys in admitting.
This is starting to get way out of hand. Hi, I'm Dr. Slay. Are you guys being blue? We had several other ER patients waiting to be seen who now in the waiting room, hearing and seeing what was going on with the blue urine, decided they would now leave, not wanting to get sick.
Emergency. Yes.
Policja, pussy! Policja! Śmielec, pusto! Śmielec!
What's going on in here?
Stormed over here and started trying to pick him up. This crazy woman.
Natasha, what are you thinking? What's going on? Look, you need to just let him rest. Stop trying to get him out of here.
Dr. Snyder has a pregnant woman in his ER whose baby's heart rate is dropping fast.
I knew that if I relayed this to the mother, it would probably make her blood pressure go up even more.
Is everything okay?
Yes, we're just tracking your vitals just to make sure that you and your baby are okay.
I'll be right back, sweetie. Dr. Snyder, can I talk to you a minute?
Sure, Walter. What can I do for you?
Saw you look worried in there. Is she gonna be okay? Is our baby gonna be okay?
I'm concerned about the rising blood pressure. It could indicate preeclampsia, and if we don't treat it quickly, I'm not 100% sure that it is, though, because that doesn't explain all of her muscle pains.
Can you please do what you can? I've been trying for a long time to have a baby, and we were told that Susan might not carry the full term, so when we got this far, we thought.
They spent a lot of money. She had a lot of miscarriages, and this was sort of their miracle child. I felt bad for him because he clearly felt helpless, and he felt there wasn't much that he can do except put his faith and confidence in me as the treating physician.
Susan, on a scale of 1 to 10, 10 being worst, what's your level of pain?
10.
Nicole, can we get her 50 micrograms of fentanyl?
Not so bad.
Thanks.
What is it?
Your white blood count is slightly elevated, which could mean a number of things.
It could mean she has an infection. It could just mean that she's under a lot of duress. And in pregnancy, your white count tends to go up. But her white count was significantly elevated. And so I was thinking that, well, maybe she has appendicitis. But I look at the blood pressure, and the blood pressure's going up. It's not going the right direction. Her heart rate's going up. I knew there was an emergency. I could clearly tell she was ill. and I didn't know exactly what was going on. She should be responding to the medications that we've given, and she's not.
Dr. Slay is dealing with an epidemic of frat boys with rapid heart rates and blue urine.
How many more?
10.
10? Sherry, let's get these guys somewhere, okay? We're gonna find a place for you guys. We're running out of beds. Listen, we gotta get some other staff in here. This is now approaching what we call a mass casualty situation, meaning it's overwhelming for the single ER doctor. At about that time, I got a call from the university medical officer, the university president, and some other administrator in a conference call saying, what is going on here? How come we're having this blue urine situation? What should we do about it? Is this an epidemic? Okay.
Doc?
Just a minute. How many more?
Is it 20?
Tell Marcy she's got to find room for 20 more patients. Look.
Okay.
Listen, I gotta go. It's a mass cal here. I've gotta go. I told them I didn't know exactly what was going on. I didn't think it was a contagious disease at this point. However, I would have to get back to them on that particular issue.
Emergency? Yes, please hold.
It was about that time that phone calls started coming into the nurses' station from the parents of the fraternity brothers wanting to know what's going on with their child. They heard there was blue urine, that they were going blind, that they were getting paralysis, and that they were getting sicker by the minute. Do they need to get on the plane and come to the university because their child is so sick?
Hey, Doc.
What's wrong?
I think my arms are going numb.
Listen, you're gonna be okay. We're not gonna let anything happen to you, okay? Just calm down.
Doc,
calm down.
My arms are getting tingly, too.
Just be calm. We're gonna keep a good eye on things here. You're gonna be fine.
Hey, look outside.
All of a sudden, I'm told there are TV camera mobile units that have arrived in the parking lot and they're coming into the ER.
Dr. Jasper is dealing with a puzzling case, an obese, nearly comatose patient and his hyperactive companion.
It's okay. Look, Natasha, Blot is my patient. He's not going anywhere, especially in a limousine. End of discussion. Look, he's really sick. Have you filled out his paperwork yet? Natasha, paperwork needs to be filled out?
No, I have not. I have to go make another phone call.
So, who's paying me? Ma'am, hey, you owe me 40 bucks.
So all this craziness is going on, and we get this man x-rayed, and it comes back. And it shows nothing. His heart's normal, no pulmonary edema, no pneumonia. What am I missing here? Hey, what's going on in
She
here?
just stormed over here and started trying to pick him up, this crazy woman.
Natasha, what are you thinking? What's going on?
Did you take X-ray?
Yes.
And what did it show?
It was fine. His heart's normal, his lungs are clear. Look, you need to just stop trying to get him out of here.
Okay, doctor, you're right. You're right about everything. I will make a phone call and wait outside.
Okay. You ever seen a wife act like that before?
She's a mean little mama. Listen, I'm Croatian, not Russian, so I got some of what she said. She kept mentioning the policja, which is police in Russian. Where are you going?
I'm going to review all of his results to make sure I haven't missed anything. So I decided I was going to go and dot all my I's, cross all my T's, and review all of his labs, his EKG, and look at his chest x-ray myself. What is that? I do notice something that looks a little strange. I say, hey, take a look at this. Does this look strange to you, or is it just me?
I really don't see anything. His chest looks fine.
No. What about his stomach?
Looks like air bubbles.
They're not air bubbles. Look, here, and here. They're like, what the heck is that?
Is this a terrorist attack?
Okay.
The CEO of the hospital and the chief of staff of the hospital called me and said, don't let the news people in.
We're here on the grounds of Central Hospital with a breaking news story, an epidemic of blue pea. Now, we're not quite certain at this moment in time exactly what's going on inside the hospital. Shock advised.
Dr. Eric Snyder has a pregnant patient complaining of severe body pain. Some symptoms indicate appendicitis, but others don't, so he's not sure.
We ordered an ultrasound to look at the baby, and the baby's still moving, although, I'll be honest with you, the heart rate's dropping a little bit, which concerns me.
Can I get a look at her appendix?
I can't see it. At 28 weeks, the baby's too big. The appendix is pushed up out of its normal position by the uterus.
Let me see your chart, please, Jody. Thanks.
We are not trained specifically to make a diagnosis. We're trained to exclude diagnoses that could potentially harm or kill a patient. And again, so we think backwards. We don't think necessarily, is this a cold? We think, is this something that's really going to hurt the patient? And if it is, we need to treat it and diagnose it. And if it's not, they should be able to follow up with their primary care provider. And so our specialty is unique like that.
We could rule out appendicitis with a CT scan.
True, but I'm concerned about harming the baby with that amount of radiation.
Again, I have two patients here. I have the mother and the baby, and I have to look after the best interest of the baby. So I'm not going to order a CT scan unless I really, really think this is what's going to make the difference in this case.
Something is telling me it's not appendicitis. It usually doesn't cause that type of muscle ache. Your blood pressure doesn't go up that high, especially when you're treating the pain. I want to cross off one of these diagnoses, but it just doesn't feel safe.
I really didn't want to expose the baby to this amount of radiation, so I decided to forego this. But I also knew that if I missed a case of diagnosis in a pregnant woman, that this could potentially lead to fetal loss, and so she could lose the baby.
Susan, Walter, I just wanted to update you as to where we stand. We can't rule out preeclampsia, though I don't think that's a problem here. We can't rule out appendicitis because we can't see the appendix and it's unsafe to perform the CT scan.
Why?
Walter, I told you I'd treat Susan as I would my own wife, and I'm concerned about the radiation exposure to your baby.
I'm very open with the family and letting them know my decision-making, letting them know what I'm thinking, what I'm doing, because I don't want them to be in the dark. I figure the more open I am, they'll trust me more. I'm not going to do anything against their will. I'm going to make sure that I have them on board, make sure they understand my decision-making, and we're going step by step.
Is it too early to deliver?
We could deliver, but it's simply not a good idea. The baby would be very premature. The lungs wouldn't be fully formed yet, and it would have to be in the hospital for a long time.
I'm feeling a lot better. Maybe everything will be better. Maybe I'll be okay.
It's just the medication working. It doesn't mean that we're at the source of the problem yet.
I'm just fixing the numbers. I'm fixing the blood pressure by artificial medications. I'm fixing the pain, which is good. She feels better. But I know that once I remove those blood pressure medications, her blood pressure is going to shoot through the roof, and the baby's going to be under more distress.
We'll figure this out, okay? Don't worry.
I'm trying to get more of a story, and trying to figure out what exactly happened. Take me back before the baby shower. Take me back, what were you doing? Were you eating anything in particular? She said, no, I woke up, I felt great, I was excited for the baby shower. I took my prenatal vitamin, I was getting dressed, I decided I'm gonna dress up for this. This may be the last time I actually wear nice clothes, so I'm gonna dress to the nines here. So she put on a really nice dress, she put on really fancy boots that she had kept out in the garage because she hadn't been able to wear them for a while and she hadn't gotten anything fancy. And then she got in the car and she drove to the baby shower.
Now, think back. When did the pain first begin?
At my shower, I started getting cramps in my right leg.
Have you had cramps throughout the pregnancy?
No, not really.
So it was your right leg that started cramping up first?
Yes.
And so I said, look, let me just do a really comprehensive exam and see if there's anything that we could potentially be missing.
We're just gonna take a look for any unusual marks on your body. We're gonna start with your back, okay? Just lean forward.
One of the other things that I noticed when I was doing this exam is that her whole gurney was essentially soaked from how much she was sweating. And I went over her entire body, head to toe, and looking for anything abnormal. And other than a little red spot on the back of her right calf, I really didn't find anything.
Is this where the pain began?
Yes.
Does it hurt?
No.
Are there any zippers or tags on your boots that could have made this mark?
No.
Are the boots new?
No, I've had them for a couple years. I keep them in the garage. I don't really wear them much anymore.
But one of the things I noticed, the bed sheet right underneath her right leg was this dry patch, right where that red spot was. And I thought to myself, this is strange. Why would she have one area that was dry and everything else was soaked? And so I had her put her leg down, and it matched directly where this little red patch was on her leg. And sort of an alarm went off. This isn't right. She should be sweating everywhere.
Dr. Snyder realizes this is a characteristic that is unique to black widow spider bites.
You get an area of anhidrosis, which means no sweating, surrounded by hyperhidrosis, meaning super sweating.
I'm just gonna take a quick picture of this mark here. Okay, I'll be right back.
Unsure of his diagnosis, Dr. Snyder consults the web on spiders and spider bites.
It fits the picture. She had boots on that she put on in the garage. Black widows like dark places. They tend to hide there, and clearly when they become bothered, they'll bite.
Listen, all you guys are going to be okay. We're not going to let
Dr. Slay's ER is filled with fraternity brothers all complaining of the same symptoms: high heart rate, cramps, and blue urine. So far, it's a medical mystery, and word is getting out.
Hey, look outside.
Shortly thereafter, the mobile TV people started showing up in the parking lot of the emergency room. In came the TV women, elbowing each other to try to talk to a representative from the hospital.
How'd they get in here?
I didn't invite him in.
Get them out of here.
Hi, can you tell us what's causing this epidemic of blue urine? Is this a terrorist attack?
Okay,
Does
come
the
on.
CDC know?
You heard the doctor, right?
One answer, please.
I said get out.
Get public
out.
safety?
Get out.
Get out! Safety, okay.
At that point, the CEO of the hospital, the public relations person, and the chief of staff of the hospital called me and said they were en route. Call a mass casualty. Don't let the news people in.
Yes, sir.
What'd he say?
He said don't let the reporters in.
Note to self, don't let in the reporters.
He's in the building.
As the patrons that abandoned the waiting room, afraid they were going to catch the blue urine disease, were exiting the ER, they were interviewed by the mobile news cameras about what's going on in that emergency room in there.
We're here on the grounds of Central Hospital with a breaking news story, an epidemic of blue pea. Now, we're not quite certain at this moment in time exactly what's going on inside the hospital. It's shut down, nobody's allowed in. Oh, no, things are changing. Let's see how the story develops. Hi, come on over. Can you tell us exactly what you saw happening to those affected by this strange illness? How many blue peers did you see in there?
What in the hell is going on here?
Sir, I wish I knew. I have no idea. These are the initial fraternity brothers that came in. We've gotten some tests back on them. So far, nothing. We're going to be testing the rest of them, and we'll get to the bottom of this.
Hey, Charles. Yeah? Can you feel your legs? No? Can you? No, dude, I can't anymore either. Dude.
All the blood work we did on them looked pretty good. The only thing that was wrong, seemed to be wrong, was they all had high heart rates, a lot of anxiety, and lots and lots of symptoms that didn't fit together.
What is your plan, Dr. Slay?
Really? A spider?
Black widow. We do have the medication to treat it, but if you're allergic to the antivenom, it can potentially be lethal to you and your baby.
Forget it.
No, I can't lose the baby.
Dr. Eric Snyder thinks his pregnant patient may have been bitten by a black widow spider.
And I called poison control and asked them, look, I've never seen a black widow spider bite. This is what's going on. I'm really concerned about this patient and her baby. I need some guidance.
What are the side effects of the antivenom? Serum sickness? That could kill her.
She says, yeah, but if you don't treat this, and it is a black widow spider bite, the baby can die.
They can't be 100% sure. Hers don't look as bad as any of these.
What are you gonna do?
I don't know. I think we have to do it.
One of the things that I always think about, and one of the things that physicians do when they graduate medical school, is we take an oath to first do no harm. But I knew this was not going to be easy.
Really? A spider?
Black widow. Very uncommon, but it makes sense since you hadn't worn the boots in a while. And it explains all your symptoms: cramping, high blood pressure.
Is it hard to treat? Will they be okay?
That's the difficult part. We do have the medication to treat it, but if you're allergic to the antivenom, it can potentially be lethal to you and your baby.
Forget it.
We can't harm the baby. No, I can't lose the baby. No.
No, I understand your concern, but this is not a case where we can just wait and see. Your baby is not tolerating this well. Unless we get the antivenom in you, neither of you are going to fare well, I'm afraid.
Are you sure it's the only way to save the baby?
I believe it's the best way.
It's an impossible choice.
I still didn't know the right diagnosis. If I give somebody antivenom that hasn't been bitten by a black widow spider, it's not going to do anything. As a matter of fact, it could still kill them.
Dr. Slay is still mystified by the outbreak of blue pea in his ER and has enlisted the help of his colleagues.
Gather around, guys. So far, all the tests have come back negative, so we don't know what's going on. And I think what we're going to be doing now is I want each one of you to take a frat boy and go get a detailed history. We've got to be missing something. Dirk, let's just start at the beginning.
Okay, well, we were at this sorority house party, and of course, we were doing a little drinking.
We found out that they had all attended a party the night before with their sister sororities.
We pranked them the week before, so we were kind of trying to, make it all right when we got there.
And they had done several things, allegedly, such as take the doorknobs off of all the doors, put saran wrap on all the toilets, and put hard candy in all the shower heads in the sorority house. The young ladies had vowed to get revenge, but they decided, well, there's probably no reason to do that. We'll have a party for these guys instead.
It started out really great, and it ended great.
And so in talking to them about the party, we found out that the young ladies had put together one of the favorite concoctions of the university students, a drink called Purple Punch.
Purple Punch.
Yeah. It's grape juice, and then there's grain alcohol in it.
Wow.
And it turned out that most of them had imbibed relatively large quantities of this substance.
And you felt fine last night, maybe a little hungover this morning?
Yeah.
I put my head together with the other ER doctors, and we said it has to be something in the Purple Punch.
Marcy. Oh, hi. Can you do that thing to get their attention for me, please?
One of the things that can cause blue urine like this and is relatively innocuous and harmless is a substance called methylene blue.
Methylene blue is a common chemical compound found in many laboratories. It is an effective anti-malarial drug and an antidote to many poisons.
All right, listen, fraternity brothers. I want you all to listen. How many of you drank the Purple Punch last night at the party? Please raise your hands.
So we decided, well, we've got to test this for methylene blue.
This has to be methylene blue in the urine from the Purple Punch. Sherry, go down to the lab, get me some sugar cubes, just regular sugar cubes, and ask them for sodium hydroxide and bring it back here. And we're going to get to the bottom of this once and for all.
Dr. Jasper and his team are taking a second X-ray on their rather strange case.
Hey, Doc. So, you're not releasing the patient?
No, he's too sick.
Okay. I'm gonna go find Natasha.
So we take the second x-ray, just of Vlad's stomach, his entire stomach.
Hey, check this out.
Vlad?
Yep.
Ooh, look at that. See, they don't look like bubbles. They look like balloons.
They're balloons, all right. About 24, I'd say.
Ooh, what do you know? I think our friend Vlad is a mule. He's smuggling drugs. And take a look at that one there. Does it look ruptured to you?
Yep, ruptured and must have leaked.
Okay, game over. Vlad, wake up. Vlad, you gotta be straight with us. What's in the balloons? Is it heroin? If it is, we can help. Okay? Go ahead. Hang in there, Vlad. This is naloxone. It'll counteract the heroin. You're gonna be okay. We're on the right track now.
Oh, shit. Wait, where's Natasha?
I think she went with the limo driver. The thing is, if he had been skinny, that amount of heroin might just have killed him. So in a way, he was lucky.
Natasha!
Although he did miss his flight.
Dr. Snyder has to treat his pregnant patient with an anti-venom that could possibly kill both her and her unborn child.
If it were my wife and child, I would do it.
Are you even sure it's a black widow bite?
Dr. Snyder has to treat his pregnant patient with an anti-venom that could possibly kill both her and her unborn child.
Are you even sure it's a black widow bite?
Walter, if it were my wife and child, I would do it. I promised you that I'd treat your family as my own, and I stand by that promise.
Okay. Let's do it.
I didn't even know how to dose this medication. I didn't know if you give it IV, if you give it your muscle, if you give it subcutaneous. So I talked to the toxicologist at Poison Control, and I spoke to our pharmacist.
Fetal heart rate?
110. BP's 140/90.
Let's give it IV. Susan, we have to treat it aggressively.
Now, if you give it IV, it's more aggressive and it works quicker, but there's also a higher risk for the patient doing poorly. I was absolutely frightened with the immediate initiation of this treatment. I didn't know what to expect. So we sort of sat there and we sort of looked at each other. Nothing was really happening.
No change.
The first thing I thought of, okay, this isn't working. I'm wrong.
Oh, wait. BP's falling.
Fetal heart rate?
It's going up, 125. Rising.
Must be working. It's working.
So at that time, in my heart, I knew it was the right diagnosis and I knew we were doing the right thing for her. And that was a huge weight off my shoulders. She was discharged a couple days later.
Jody.
And went on to have a full-term pregnancy.
To Dr. Snyder, our bundle of joy, Harvey.
A beautiful baby boy. It's just one of those cases that you will never forget.
Dr. Bob Slay is testing whether his patient's blue pea is caused by the chemical methylene blue.
A little sodium hydroxide. We're gonna shake it up. Clear, that proves that it's methylene blue. Thank you very much. Thank you very much.
Just as Dr. Slay believes he has found the cause of the blue urine epidemic, he receives an unusual phone call.
Hello?
So I went over and took the phone call. There was a very young female voice, and she said,
"Are you the ER doctor taking care of the boys with the blue pee-pee?"
And I said,
yes, I am. Who's this?
And she said, well, tell those little boys that their pee-pee's gonna continue to be blue, and their little pee-pees are gonna turn blue and drop off.
Listen, who is this? Who is this? Just help me out here. Listen, just tell me this. Was it methylene blue?
And there was a pause, continued laughter, and then the young lady came back and said,
"You know, you're a pretty smart ER doctor."
and hung up the phone.
Yeah, well, guys.
This was group hysteria. It's rare in ERs, but it can happen. When you see that happen, what they'll do is they will adopt the symptoms of the person near them, and it just spreads almost like a contagious disease. So when one of them started saying, "I can't feel my legs, dude," the other guy'd say, "You know, mine feel funny too." And then the other guy down here say, "Yeah, mine too. I don't know if I can walk anymore." And it would just go on and on. And actually talking him out of it once we found out about the methylene blue was difficult.
There's nothing wrong with you. You're going to be fine. You're going to be absolutely fine. You're all going to be going home. Every one of you is absolutely fine.
So to break that, you have to convince them that you're absolutely not in any danger.
You're all right. Don't worry about a thing. Nothing hurt but your pride.
Now, it seemed like chaos in there. Tell us how it all worked out.
Well, my trauma team in this facility is about as advanced as you can possibly get. And that allows us to have a rapid response like what you experienced in there today. My team is, without question, the finest in the state.
That's great. Thank you. We got that. All right.
So we sent the frat boys on their way, never heard another peep out of them. But then, about 10 years later, something very strange happened. Well, you know, I've had a few hysteria cases myself in the ER. One of the most famous was the one called the blue pea hysteria.
I know about that one. I was there for that, the blue pea hysteria.
You know about that one? Were you in the sorority involved?
Yeah.
And you told me you were a chemistry major.
Right, yeah.
Wait a minute. You had to be involved. You know about methylene blue and all that stuff. You had to be involved. Just tell me.
And she just smiled and said,
"You know, you're a pretty smart ER doctor."
exactly the same voice I had heard 10 years earlier from the sorority, but never admitted it, never confessed. So we don't really know, but we have our suspicions.